Celiac disease is an autoimmune disorder that can cause numerous symptoms, ranging from digestive concerns to fatigue, skin issues, and nutritional deficiencies. These symptoms are triggered by the ingestion of gluten, a type of protein found in wheat, barley, and rye. This sets off an immune response, causing inflammation and damage to your small intestine. Keep in mind that symptoms of celiac disease may vary widely from person to person, and some people with celiac disease may not notice any symptoms at all. Still, if you experience any of the common symptoms associated with celiac disease, it may be a sign that you should get tested for the condition. Here are the 9 of the most common signs and symptoms of celiac disease. Before we hop in, we'd love you to give us a like. And make sure to subscribe to STATERA to keep up with all our latest content. Right now it's time to discover, what are the symptoms of celiac disease? 1. Diarrhea. Loose, watery stool is one of the first symptoms that many people experience before being diagnosed with celiac disease. According to one study, around 43% of people with celiac disease have diarrhea. This percentage is significantly lower than it was before the introduction of blood tests, which are now widely used to diagnose celiac disease. Fortunately, following a gluten-free diet usually resolves many symptoms of celiac disease, including diarrhea. In fact, in one study in people with celiac disease, those who followed a gluten-free diet reported significantly less diarrhea than those who didn't. However, keep in mind that there are many other possible causes of diarrhea, such as infection, other food intolerances, or other intestinal issues. 2. Bloating. Bloating is another common symptom that people with celiac disease experience. Celiac disease can cause inflammation in your digestive tract, which may result in bloating and other digestive issues. In a small study in 85 people newly diagnosed with celiac disease, around 9% experienced bloating, alongside other digestive symptoms. Another study in 200 people with this condition showed that following a gluten-free diet significantly reduced symptoms like bloating and improved quality of life. In some cases, gluten may cause digestive concerns like bloating even for people who don't have celiac disease. For instance, one study found that gluten worsened symptoms like stomach pain, bloating, and fatigue in people with irritable bowel syndrome. 3. Gas. Excess gas is a common digestive issue experienced by people with untreated celiac disease. According to one study in 130 children with celiac disease, approximately 47% experienced increased flatulence. Similarly, an older study in 193 adults with celiac disease found that around 7% experienced excess gas. However, keep in mind that there are many causes of gas. One study in 150 people complaining of increased gas found that only 2 individuals tested positive for celiac disease. 4. Fatigue. Decreased energy levels and fatigue are common in people with celiac disease. One large review found that people with celiac disease had high levels of fatigue, which generally improved after following a gluten-free diet. Another study found that those with celiac disease were more likely to have issues associated with sleep, which may also contribute to fatigue. Additionally, untreated celiac disease can cause damage to your small intestine, resulting in vitamin and mineral deficiencies that may also lead to decreased energy levels. 5. Weight loss. A sharp drop in weight and difficulty keeping weight on are often early signs of celiac disease. This is because your body's ability to absorb nutrients is impaired, which may lead to malnutrition and weight loss. One study found that nearly 29% and 26% of children with celiac disease had a low body weight and low body mass index, respectively. In an older study in older adults with celiac disease, weight loss was one of the most common symptoms. Following treatment, not only were symptoms completely resolved, but participants gained an average of 17 pounds. Similarly, another study in 42 children with this condition found that following a gluten-free diet significantly increased body weight and BMI after 1 year. 6. Iron deficiency anemia. Celiac disease may impair nutrient absorption and lead to iron deficiency anemia, a condition caused by a lack of healthy red blood cells. Symptoms of iron deficiency anemia include fatigue, weakness, chest pain, headaches, dizziness. According to one review, iron deficiency anemia is present in approximately 40% of people with celiac disease. Another study in 455 children with celiac disease found that 18% were anemic. In 92% of participants, anemia resolved after they followed a gluten-free diet for an average of 1 year. Similarly, an older study in 727 celiac patients reported that 23% were anemic. Those with anemia were twice as likely to have severe damage to the small intestine, as well as a low bone mass caused by celiac disease. 7. Constipation. While celiac disease may cause diarrhea in some people, it may cause constipation in others. Celiac disease damages the intestinal villi. These are tiny finger-like projections in the small intestine, and they are responsible for absorbing nutrients. As food travels through your digestive tract, the intestinal villi are unable to fully absorb nutrients and may often absorb extra moisture from the stool instead. This leads to hardened stool that's difficult to pass, resulting in constipation. However, even on a strict gluten-free diet, people with celiac disease may find it challenging to avoid constipation. This is because a gluten-free diet cuts out many high-fiber foods like grains, which may result in decreased fiber intake and reduced stool frequency. 8. Depression. Celiac disease results in psychological symptoms like depression alongside physical symptoms. An older analysis of 29 studies found that depression was more common and severe in adults with celiac disease than in the general population. Another review of 37 studies linked celiac disease to an increased risk of depression, anxiety, and eating disorders. Furthermore, one review noted that anxiety, depression, and fatigue were commonly reported among those with untreated celiac disease, which may negatively affect quality of life and dietary adherence. 9. Itchy rash. Celiac disease may cause dermatitis herpetiformis. This is a type of itchy, blistering skin rash that occurs on your elbows, knees, or buttocks. Approximately 17% of people with celiac disease experience this rash, and it is one of the telltale symptoms that leads to a diagnosis. It may also develop after diagnosis as a sign of poor adherence to treatment. People who develop this skin rash rarely experience the other digestive symptoms that commonly accompany celiac disease. If left untreated, celiac disease may be associated with several other health concerns, such as nutritional deficiencies, infertility, osteoporosis or bone loss, gluten neuropathy or numbness, tingling and nerve pain, bone, muscle, or joint pain. Additionally, celiac disease is an autoimmune disorder. This is a condition that occurs when your immune system attacks the healthy cells in your body. Research shows that people with one autoimmune disorder have a 25% higher risk of developing others as well. Other autoimmune disorders that may accompany celiac disease include rheumatoid arthritis, ulcerative colitis, Crohn's disease, multiple sclerosis, Hashimoto's disease, Graves' disease, systemic lupus erythematosus. Consult your doctor if you have diarrhea or digestive discomfort that lasts for more than 2 weeks. Consult your child's doctor if your child is pale, irritable or failing to grow or has a potbelly and foul-smelling, bulky stools. Be sure to consult your doctor before trying a gluten-free diet. If you stop or even reduce the amount of gluten you eat before you're tested for celiac disease, you can change the test results. Celiac disease tends to run in families. If someone in your family has the condition, ask your doctor if you should be tested. Also ask your doctor about testing if you or someone in your family has a risk factor for celiac disease, such as type 1 diabetes. Finally, if you have any specific questions or concerns, don't be shy to comment below the video. And please like, subscribe, and ring the notification bell, so you can stay up to date with our informative vids. Thanks for watching. Now go have yourself a happy and healthy day.